As the world grapples with emerging health threats, the H5N1 virus looms ominously, challenging our existing frameworks of disease control and public health. This avian influenza virus, once primarily confined to poultry, has demonstrated an alarming capacity to cross species barriers, infecting a vast array of hosts and establishing itself as a global threat. With over 500 species now affected, H5N1's reach extends across continents and ecosystems, earning its designation as a panzootic. The virus's persistent adaptability and severe health impacts underscore the urgency of a comprehensive response. The interconnected nature of H5N1's spread, from its transmission pathways to its socio-economic repercussions, reveals a complex web of influences that reinforce each other, creating a cycle of persistent outbreaks and escalating crises. The global response to this virus is further complicated by the varied effectiveness of public health measures, the limitations of voluntary tracking efforts, and the socio-political challenges that have intensified post-COVID-19. These factors collectively form a multifaceted challenge that requires a nuanced and coordinated approach. In this analysis, we delve into the critical factors that drive the H5N1 crisis, exploring the negative scenarios that currently dominate our reality. Through a detailed examination of virus characteristics, transmission pathways, geographic distribution, prevention measures, health system preparedness, and socio-economic influences, we uncover the reinforcing nature of these problems. Each triad of factors presents a unique set of challenges that, when unaddressed, perpetuate the cycle of outbreaks and instability. However, within these challenges lie opportunities for transformation. By identifying and implementing strategic improvements, we can convert these negative situations into affirmed states where positive influences reinforce each other. Our analysis not only highlights the existing issues, but also offers a roadmap for creating a more resilient and effective response to H5N1. Imagine a world where a single virus infiltrates our very fabric of life, striking down birds, mammals, and humans alike. H5N1, with its insidious adaptability, leaps from one host to another, demonstrating a chillingly expansive range. This virus, capable of infecting over 500 species, evades containment and control with unnerving ease. In bustling markets, infected birds squawk and flutter, spreading the virus through direct contact and contaminated environments. Ineffective biosecurity measures leave poultry farms vulnerable, turning them into breeding grounds for the virus. As the virus spreads, it unleashes severe symptoms and high mortality rates upon humans and birds, creating scenes of respiratory distress and sudden death. Hospitals become overwhelmed with patients struggling for breath, while the economic heart of communities, the poultry industry, crumbles, leading to food insecurity and financial despair. These factors, intricately linked, form a vicious cycle of continuous outbreaks, severe health impacts, and economic devastation. To combat this dire scenario, we need a comprehensive understanding of the virus's host range and adaptability. By mapping and predicting its spread patterns, we can develop targeted containment strategies, halting its progression. Enhanced biosecurity measures and public education on transmission pathways are crucial. Implementing strict protocols in poultry farming and markets, combined with raising awareness about how the virus spreads, can significantly reduce environmental contamination and secondary transmission. Advances in medical treatments and preventive measures are vital to mitigate the severity of symptoms and reduce mortality rates. By developing and distributing antiviral medications and vaccines, and ensuring proper medical care, we can lessen the virus's deadly impact. Economic support mechanisms for the poultry industry can stabilize this vital sector, ensuring food security and economic resilience. Accurate mapping and prediction of the virus's spread enable targeted containment. Strict biosecurity protocols minimize transmission, and improved medical treatments reduce mortality. Together, these positive influences create a cycle of prevention, control, and stability. Picture a world where the H5N1 virus infiltrates not just poultry but cattle herds, amplifying its reach and danger. In rural areas and industrial farming operations, cattle mingle with other livestock and wildlife, creating a perfect storm for viral transmission. Poor monitoring and control in these regions allow the virus to spread unchecked, leaping from birds to cattle and then to humans. International cooperation is fragmented, leaving gaps in our global defenses that the virus exploits. Prevention and control measures remain insufficient, as vaccination and biosecurity protocols are voluntary and inconsistently applied. High costs and logistical challenges further impede the implementation of effective prevention strategies, turning efforts into a patchwork of inconsistent and ineffective measures. Insufficient vaccination, biosecurity, and public health measures leave us vulnerable. The high costs and logistical challenges impede the implementation of effective prevention strategies. Emergency health systems, unprepared for this new dimension of the outbreak, struggle to manage the surge of cases. Slow identification and isolation of infected cattle and humans lead to widespread infection, overwhelming healthcare facilities and causing a rising tide of casualties. These issues, reinforcing each other, create a feedback loop of persistent outbreaks, inadequate responses, and escalating health crises. To address these specific challenges, continuous monitoring and localized control in regions with cattle farming are essential. Establishing dedicated surveillance systems and resources for industrial farming operations can help detect and manage outbreaks early, preventing them from spreading to humans. Strong international cooperation is vital, ensuring that countries share information, resources, and strategies to combat the virus effectively. Efficient vaccination programs for cattle and robust biosecurity protocols must be mandated, supported by adequate funding and logistical planning. This would involve comprehensive vaccination campaigns, stringent biosecurity measures in farming operations, and public health initiatives to educate and protect farmers and rural communities. Emergency health systems need to be well equipped and prepared, with adequate capacity and rapid response mechanisms tailored to both livestock and human health. Swift identification and isolation procedures for infected cattle and humans can contain outbreaks quickly, minimizing their impact on public health. In this improved state, regions with cattle farming have dedicated monitoring systems, strong international cooperation manages global spread, and health systems are equipped for rapid response. Effective biosecurity protocols and mandatory vaccination programs prevent outbreaks and reduce transmission from cattle to humans. These positive influences create a cycle of effective prevention, control, and preparedness, reducing the impact of H5N1 on public health and global stability. Consider a world where our ability to track and respond to the virus is hindered by voluntary efforts and inadequate surveillance. Gaps in data and underreporting create a fragmented picture of the outbreak, delaying our responses and allowing the virus to spread unchecked. The public, weary and resistant after the COVID-19 pandemic, push back against new health measures. Increased skepticism and fatigue lead to non-compliance with lockdowns, travel restrictions, and vaccination campaigns, undermining efforts to control the virus. High population density and movement accelerate the virus's spread, while the economic impact on sectors reliant on poultry farming exacerbates the problem. Communities face financial ruin as outbreaks decimate the poultry industry, leading to severe economic instability. These factors, reinforcing each other, create a cycle of poor tracking, ineffective public health measures, and escalating socio-economic challenges. To convert this problematic scenario into a more positive state, robust surveillance systems and reliable data sharing are crucial. Comprehensive and transparent reporting mechanisms can provide accurate information on outbreaks, enabling timely and targeted responses. Effective communication and community engagement are essential to build public trust and cooperation with health measures. Clear, consistent messaging about the importance of health interventions and the benefits of compliance can foster public cooperation. Strong enforcement and public cooperation can ensure the successful implementation of measures like vaccination and movement restrictions. Addressing socio-economic factors is also vital, with controlled population movement and density through public health infrastructure. Economic support mechanisms for affected industries can mitigate the financial impact of outbreaks, stabilizing the poultry sector and ensuring food security. In this affirmed state, reliable tracking and data sharing provide a clear picture of outbreaks. Public cooperation ensures effective health measures, and supportive socio-economic policies control virus spread. These positive influences reinforce each other, creating a cycle of accurate information, effective interventions, and socio-economic stability. Now imagine the ecological landscape where wild birds and domestic poultry interact unchecked, with climate change exacerbating the situation by altering habitats and migratory patterns. These uncontrolled interactions create a fertile ground for the virus to spread across species and regions. Slow advancements in detection and research mean we are always a step behind, with inadequate data analytics and modeling for outbreak prediction. This hinders early detection and accurate forecasting, delaying effective responses. Political and governance factors further complicate the issue, with weak policies and regulations for outbreak management, and a lack of public trust and ineffective governance undermining efforts to control the virus. The public, skeptical of government actions and distrustful of authorities, resist compliance with necessary measures. These issues reinforce each other, creating a cycle of environmental vulnerability, technological lag, and weak governance, leading to persistent and widespread outbreaks. To improve this situation, we must control interactions between wildlife and domestic poultry through effective biosecurity measures. Implementing strict protocols to prevent cross-species transmission and adapting to climate change impacts on virus spread are essential. Proactive measures can reduce the risk of outbreaks and contain the virus more effectively. Rapid advancements in diagnostic tools and genomic research are crucial for early detection and accurate outbreak prediction. Comprehensive data analytics and modeling can provide timely information and forecasts, enabling proactive responses. Strong and clear policies for outbreak management, supported by transparent and accountable governance, are necessary. Building public trust through consistent communication and effective management can ensure compliance and cooperation with health measures. In this affirmed state, effective biosecurity and proactive climate change adaptation prevent virus spread. Advanced diagnostic tools enable early detection, and robust governance ensures coordinated and transparent outbreak management. These positive influences reinforce each other, creating a cycle of environmental control, technological advancement, and strong governance, leading to better management and mitigation of H5N1. In each of these triads, we see how interconnected factors exacerbate the current challenges posed by H5N1. However, within these challenges lie opportunities for transformation. By identifying and implementing strategic improvements, we can convert these negative situations into affirmed states where positive influences reinforce each other. Our analysis not only highlights the existing issues, but also offers a roadmap for creating a more resilient and effective response to H5N1. Through comprehensive understanding, enhanced biosecurity, robust surveillance, effective public health measures, and strong governance, we can break the cycle of reinforcement and pave the way towards a safer and more stable future. This holistic approach underscores the importance of coordinated global efforts in combating the H5N1 virus and protecting public health worldwide. By addressing these factors comprehensively and creating positive reinforcing influences, we can move towards a more controlled and manageable state, reducing the impact of the virus on global health and stability.